Emergency medicine physicians are medical specialists who provide immediate evaluation and care for people with an acute illness or injury. They provide care to any patient irrespective of his or her age, gender, financial status, religion, race, or creed during any time of the day or night for any type of emergency. Emergency medicine physicians are masters of resuscitating the very sick. They work in an area of the hospital called the emergency department, which is sometimes also called the accident and emergency unit. South African emergency medicine physicians face multiple and varied emergencies that arise from our country's quadruple burden of diseases. These are the HIV/AIDS epidemic, alongside a high burden of TB and other respiratory infections, high mother and child mortality, high levels of violence and injuries, and a growing burden of chronic lifestyle diseases such as hypertension and diabetes, leading to complications such as heart attacks and strokes. Most emergency departments have limited resources to cope with this flood of serious conditions. Emergency medicine physicians evaluate critically ill or injured patients and simultaneously treat them by performing emergency procedures. For example, when a person was in an accident, they may first scan the body to assess the type and seriousness of the injuries. In many instances, they have to do an endotracheal intubation. This is a procedure in which a tube is placed into the windpipe through the mouth or nose. They also have to insert drips or intravenous lines to administer fluids and urgent medications. If the patient has any open wounds, they attend to them. An ultrasound scan may also be done of the chest and abdomen to check the condition of organs such as the heart, spleen, liver, and kidneys. In the case of broken bones, the emergency medicine physician may speak with a consulting surgeon in order to determine further procedures. Emergency medicine physicians must be decisive. They must be good at multitasking, since many patients may require assistance at the same time. They must also be very good at communication, since they have to communicate with patients, families, colleagues, nurses, porters, and many other people during a shift. They need to be altruistic, since it is hard work with difficult hours. There are opportunities to make a big difference to patients' lives when they are at their most vulnerable. Life-saving procedures and management protocols can be very satisfying to perform. Many emergency medicine physicians describe their work as the most interesting first 10 minutes of all the other specialities. An immediate result can often be seen by performing relatively simple procedures. Many doctors enjoy shift work, with the opportunity to have carefree off days and to be able to hand over the responsibility of patients to their colleagues when they go off shift. Emergency medicine is a dynamic and innovative specialty with a high emphasis on evidence-based medicine. Emergency medicine physicians are leaders in FOAM, or Free Open Access Medical Education. This includes education through platforms like social media, including Twitter, Facebook, and Instagram, and through educational podcasts, videos, and websites. This makes this specialty very attractive to a younger generation of tech and social media savvy doctors.